So in the next half an hour or so, we'll be talking about cancer prevention. First of all, let us understand why we have to worry about cancer. If you have gone through the WHO literature, it tells you that cancer is the third most common cause of death in the world. Third most common. The first is cardiac. Second is infections like tuberculosis and all HIV and all those. And the third is cancer. 25% of people living today, that means all of you, including me, 25% of us are likely to develop cancer sometime in our life. That means 1 out of 4 of us is likely to develop some form of cancer throughout our life. So that is an alarming number. But what is good part of it is, there are measures to prevent cancer. It is not like, you are surely going to develop. There are measures by which you can reduce your risk. You can make yourself less vulnerable to cancer. And also, you can detect cancer early so that you have a higher chance of cure. So these two measures are the most important measures when it comes to cancer prevention. So same thing put in a different way. Cancer awareness basically has two branches, that is to reduce the risk on one hand, and on the other side you have to do an early detection. So these two components are the two arms which are most important for cancer prevention. Now many of you must be having bikes. Which group do you belong to? This or this? Probably this, isn't it? Huh? Yeah, that's what you will be doing. This is what you will be doing. But if there is an accident, who's more likely to have a head injury? This or this? Huh? That one. So it's quite obvious. So by wearing helmet and all the other protective gears, this chap on your left side is likely to prevent lot of injuries to himself. So basically we are first talking about reducing the risk. This is how I put it, the 5 stars of risk reduction. What are these 5 stars? Number 1 in that is tobacco, second is alcohol, third is infection, fourth is the activity and the diet, and fifth is pollution. Smoking, what is smoking? So fire at one end and full at the other. In between is the cigarette. So 70% of lung and oral cancers are caused by smoking. Okay, 70%, 70 to 80% they say is caused by smoking. And 22% of cancer deaths per year is attributable to tobacco itself. So look at the number. You are talking about a huge number of cases. And it is not only the smoked tobacco, it is the one which is below here, the chewed tobacco. Tobacco in any form is dangerous. And look at the list of cancers that I have put here. List is really huge. It is not just one cancer, it's not 1 or 2 cancers. Tobacco can affect every part of your body, from mouth to the urinary bladder. Every form of cancer can be caused by tobacco. So that is the enormity of this one particular menace. And when you think about it, it is a single greatest avoidable risk factor. It's better to say no to tobacco as early as possible than to regret later. It is not only cancer, it causes a lot of other illnesses. Even cardiac illness, it is a very well known factor in cardiac illness also, heart problems. So this 22% which I am talking about is just an underestimation, because cardiac deaths are more common. Second factor is alcohol. Now what does it contribute to? It contributes to about 22% of cancer among men and 9% among women. There is a difference, probably because lesser intake. And it is directly proportional to the amount of alcohol that is consumed. And what is more important to understand is, when it is taken with smoking, when it's combined with smoking, the risk is much higher. Can you imagine why? Alcohol is a solvent, isn't it? You are aware that alcohol is a solvent. So it solves the carcinogens. There are about 400 carcinogens in tobacco. So it beautifully mixes it up and makes it available for the body to absorb. So automatically you are increasing your risk of getting cancer. Third important thing that I want to point out to you, and very often ignored, is the fact that infection can cause cancer. We forget about that. We tend to think that infection is infection, cancer is cancer, two different entities. Not true, because 22% of cancers are caused by just 4 organisms. And what are these? Hepatitis A, B and C, human papillomavirus, and Helicobacter pylori bacteria infection. It's a bacteria. The other three are viruses. Can we prevent this? Yes, we can. Hepatitis B and HPV can be prevented by vaccine. H. pylori infection can be treated. Now, how are hepatitis B and C transmitted? It is one of the major source of infection is sexual transmission. Other than that, there is a vertical transmission from mother to child. Then sharing of needle in drug, because of drug addiction. Blood, through blood products and blood, that has been almost eliminated because of the safety measures that exist. Apart from that, needle stick injuries. You are using some needle somewhere, you get injured because of that. Mainly for medical professionals and all, there is a high risk. What happens, why is it so problematic? What is hepatitis? What does it cause? There is jaundice, basically. It is viral jaundice. There is hepatitis A, hepatitis B and C. A is because of food, you eat somewhere on the roadside or somewhere, you get infected, and that is hepatitis A. That is not as risky as B and C. Hepatitis B and C, I told you, is through blood and sexual route. And the problem with hepatitis B and C is some number of people who get that end up with chronic infection. And these chronic infections, when they persist for longer time, lead to cirrhosis, and then later on lead to cancer. So this is the major problem with hepatitis B and C. So can we prevent it? Yes, we can. Hepatitis B vaccines are available. And hepatitis B is the most common. Other virus that I spoke about is human papillomavirus. This causes cervical cancer, and this is a women specific cancer, and it occurs in 30 to 40 age group, and that is the most productive age group. When you are working, you have responsibilities, you have children, so that is the age group where it really hits. And that is a problem with this particular disease. And this is the most common cancer in Indian women. So that is and we see it very commonly. Today there are 2 cancers. One is breast cancer, other one is cervical cancer in India. These 2 are competing with each other, practically speaking, for the first place. So in urban India, it is breast cancer which is picking up, and in rural India, it is cervical cancer. More than 90% of cancers, cervical cancers, are caused by HPV. And this contributes to about 10% of cancer deaths worldwide. It may be more in India. So we are talking about a very, very significant problem worldwide. And this is also a sexually transmitted disease. So HPV, what it does is it causes infection in the uterine cervix of the uterus. 90% of the people will cure the infection by themselves. We don't need to treat anything, don't need to do anything. But a small percent of the people, that is less than about 1%, will end up with cancer. And that too over 10 to 30 years. So there is a huge long period of time in which it can be detected, it can be cured. I think more than 70% of these cases come to us late. So a very much preventable problem, but we are not able to deal with it. How to deal with it? Primary prevention of this would be HPV vaccine. two vaccines are available today. These vaccines can reduce the risk by about 70%. 70% because there are about 100 HPV vaccines, viruses, 100 HPV viruses, out of which the most common cause is HPV 16 and 18, and these two predominantly deal with that. So it's a definite and good reduction in risk, but this vaccine at present is costly, so many people are not preferring to take it. When I told you these two are sexually transmitted diseases, sexual hygiene comes as a paramount factor in this prevention of these diseases. The other one which I spoke about is H. pylori infection. The prevention of H. pylori is mainly by food hygiene. Up to 70% of Indians may be infected with H. pylori. In more than 80% of patients, it causes only chronic gastritis. It leads to cancer in less than 1% of the patients, but that also is significant number when you talk about the population of India. It's a huge number. What can we do? It is, one I told you, is food hygiene. The second thing which is very important is to diagnose the disease early or the presence of infection. So this can be done with, when there is a symptom like dyspeptic, we call it dyspeptic symptom. That is, patient, the moment the person has food, they get severe bloating and they get nausea. They don't, vomiting sensation. So they find it very difficult to have food, and this is one of the most important signs. I think all of you will suddenly say, no, all of us have it, right? Because of gastritis, basically. So basically it causes symptoms of gastritis only, but it doesn't mean that everybody who has it has H. pylori infection, or it doesn't mean that you have gastric cancer. So that is why that age criteria we have put in. So usually a person who is more than 55 years of age suddenly starts developing this kind of symptoms, that person needs to be investigated. Otherwise, it is not like every Tom, Dick and Harry who is walking around with gastritis needs to be put for endoscopy. It's not necessary to do that. And H. pylori infection, when it is present, we can treat with antibiotics, and there is a course for it. I won't go into it. The other factor which is very important for all of you, because the tendency today is to become couch potatoes. Today the amount of activity among people is reduced significantly, and that is one of the major causes of cancer. And it is a major cause of cardiac diseases also. We have spoken about, it's been extensively talked about. Be active, do things, do the workouts, go for a walk, at least for half an hour a day. And these same things, these activities can significantly reduce the risk of cancer in you. So regular activity, this chart speaks of it. This person is more likely to develop cancer than this. So it's extremely important that you keep yourself active, which means you have to climb up the stairs, don't use the lift. The last factor which in the prevention is pollution. Can you do something about it? We can do certain things about pollution. That is, in-house pollution, indoor pollutions we can always avoid. And that is the important thing, like for example, coal fire and even our cooking gas. If you close the windows and use cooking gas, that gas which remains inside the house can cause lung cancer. So I see a lot of patients who come to me, women, non-smokers, coming to me with lung cancer. They have not done any smoking in their life, but they are with lung cancer. Not even second-hand smoke. Second-hand smoke is, some husband smokes and women get some amount of smoke. Not even that. So one of the factors which could be involved in that is use of coal or indoor cooking. That could be a factor which could be involved in this. Pesticides are another factor. There are other things like heavy metal poisoning, like arsenic, which is there seen in mostly in northern India, not in South India. So reduce pollution. Whatever pollution you can reduce from your side, you can always contribute to it, and that will reduce the risk of cancer. Now, coming to the second arm of cancer awareness, that is that is early help. What do I mean by early help? What does this scene tell you? This is an accident scene. There is a bike over here and the victim is here. What has happened, what is the most important thing here is that the help has reached the person as early as possible. So the arrival of help is very important. So how does it translate into cancer? It translates as an early detection program. So when it is detected early, we can save lives. I think you might have heard of the golden hour when there is an accident, right? Golden hour is the time when you can save the person's life if the person gets medical attention. So same way, there is a golden hour in early cancers when, if detected, the cancers can be cured. We can do it by screening programs. Screening program basically means, there are very simple tests, and these are done not on patients, they are done on healthy population, and it is done, and the idea is to detect cancer before they cause symptoms. It is not like wait for symptoms to occur and then go to the doctor. It is to be in a program where you avoid the occurrence of the symptom. You have to detect it before symptoms start so that you can achieve cure. So the crux of this is cancer can be cured if detected early. That is the crux of doing this screening program. So which all cancers can we do it? We can do it in women, it is breast and cervical cancer. Added to it, it is oral and colorectal cancer. These are the 4 cancers which contribute significantly to the cancers in the world. In fact, they are the most common cancers in India and in the world. So if we can tackle these, then we are reducing a lot of cancer deaths. So the idea is to detect these cancers early. There are 5 points to early detection as well. And what are these 5 points? Mammography, pap smear, oral screening, and fecal occult blood and awareness. I'll come to it, each one of this. These are the 5 things if you can adopt in your life, you will be safer. Now what is mammography? Mammography is just a simple X-ray tool which detects early breast cancer. Small thing which is not seen, nothing is felt. So this X-ray detects it, we can investigate it, and we can reach a conclusion whether it's a cancer or not. When do we need to start? It's only after the age of 50, and this is to be done once in a year. Okay, so anybody who is above age of 50 needs to undergo one mammography test every year. Apart from this, there are other things, that is breast self-examination. So basically, you have to be aware of changes in yourself. So if you can do that, if you detect something abnormal, bring it to the attention of the doctor. Why is it necessary? It's necessary because you save life and you can save breast also. There is no deformity at the end of it. Earlier we spoke about prevention of cervical cancer. But we can detect it early also by measures which will prevent cancer deaths. A simple test that exists for it is pap smear. It is actually internationally recommended that the person starts at the age of 21 every year and go on till about 60 years of age. So pap smear yearly done can save a person from a death from cervical cancer, because when it is detected early, it's a very, very simple measure, very small operation which can save. But when it is detected late, it becomes very, very complicated. Apart from that, I told you it's about approximately 60% to 70% reduction in risk by vaccine. I have discussed that in detail. Other thing is oral cancer. Yes, I can already see people turning their heads other side. I can show you much worse pictures. But remember this is because of tobacco, mostly tobacco. So you can see tobacco stains here. This is a woman who came to me recently. Look at the white patch over here. That white patch, if left alone, can lead to cancer maybe in 10 years time. Maybe 5 years, maybe 10 years. So this is because of tobacco use. You can see the tobacco stain in on her teeth. She chews tobacco. So this is an early cancer. Early, it's not cancer, it's pre-cancer. It will lead to cancer. And it's so simple, the person just has to open her mouth or his mouth and look in the mouth to see, look at any abnormal patches, white patches, red patches. It is as simple as that. And when this is detected, it can be prevented from reaching this stage. This does not happen overnight. This would have been there in this stage for about 5 years or so, and then suddenly would have started growing in 3 months, 4 months. So this transformation from this to this can easily be prevented. And one of the most important thing of prevention I told you is stop using tobacco. If you don't want to reach here, stop using tobacco. And detect it early. There are other causes from tobacco also, so observe yourself for any changes. If there is a patch like this, it is a time to approach your doctor. Other thing which can be prevented, I told you, is colon cancer. Very simple test, fecal local blood done on yearly basis after the age of 40 can detect a lot of cancers, colon cancers. Means, test of stool examination once in a year. And other test which is suggested is colonoscopy, where you put a scope through into the colon and look for any abnormalities. That is recommended once in 10 years. But it is a difficult process for asking anybody to go through this particular colonoscopy once in 10 years. Even if person goes for fecal test, stool test once in a year, it is more than sufficient. And this is not at a young age. Remember, it's only after 40-45 years of age that a person needs to go for. And the last point in this, the fifth star, is awareness and awareness of self. Very important thing to remember is cancer is a painless lump. Very, very often I come across patients who come to me and tell that I did not have any pain, so I ignored it. And that is the biggest mistake anybody does. So a painless lump is a dangerous thing. If it is paining, it is more likely that it is not cancer. Okay? And when I say that, pain in cancer is seen very late. Means, when it's very advanced disease, that's when you see pain in cancer. So always remember that a painless lump is a warning sign of cancer. Again, I'll flip side of it. Not all painless lumps are cancers. Okay? So pain and cancer are not equal to each other. In fact, they are not seen with each other. But the painless lumps can be non-cancerous also. Apart from that, any wound that does not heal, blood in stool, persistent indigestion, as I told you, for stomach, and there is chronic hoarseness of voice. Voice suddenly changes for a person and then it's completely hoarse for 15 days, 20 days. And lot of other changes in your body, anything abnormal that occurs which was not there, and it remains that way for about 15-20 days. Then you have to think that there could be some problem. I need to approach a doctor. I have to take a medical help. So most important thing is to be aware. So anything that grows quickly, again, very quickly if it grows, and if it does not heal in 15 days, that could be cancer. Means suddenly some lump grows somewhere. Okay, somewhere in any part of the body. Suddenly it grows and it does not disappear or vanish or reduce in size for 15-20 days, then it needs to be investigated. When men reach about 50 to 60 years of age, the risk, and as they get older, the risk of prostate cancer increases. And there is no definite method to prevent it. There is nothing that has shown to prevent it definitively. Like, some other cancers which I spoke about, there is nothing like that. As far as there is a way to detect it early. So what we call as PSA testing, there's some factor in the blood what is called prostate specific antigen. We can use prostate specific antigen as a marker to see whether it is increasing in blood, and if it is increasing in blood, then we can investigate the person to see whether there is any tumor in the prostate. There are tests to do, ultrasound, certain MRI scans. Those things can detect prostate cancer. So what we can do is we can do early detection of prostate cancer and prevent death because of that, but we cannot prevent the occurrence of prostate cancer. But the other side of it, I'll tell you, prostate cancer is not one of the deadliest diseases when it occurs later on in the age. If the person is above 60 years and develops prostate cancer, the punch line over there which is said is that person is more likely to die with prostate cancer than because of it. Some regions of the world, for example, Africa is a continent which is prone more for prostate cancer, very high incidence. So in those regions, the surveillance for prostate cancer is extremely important. So the take home points from today's talk: to remember that many cancers can be prevented by lifestyle change. That alcohol and smoking, stopping of that alone can reduce the risk by about 70 to 80%. Just stop alcohol consumption and tobacco use. That reduction is really significant. Apart from that, I told you vaccines are there. Vaccine can further reduce the risk of certain cancers. So imagine, that much reduction is possible just by certain small changes in our life. And apart from that, to be aware of cancer, aware of changes in the body and getting into screening programs. So to remember that cancer is painless when it starts, and cancer can be treated successfully when it is detected early. So these are the takeaway points for you, and remember this, and with this you can reduce about, I think, 80% risk. Thank you.